Welcome. I'm Hugh Downs. Henry Ford once said, "Don't find a fault, find a remedy." Many businesses found success with that concept. It helped shape the economic and social character of our country. That inspiration to find a remedy is alive and well today.
It's been said that no job is finished until the paperwork is done. Nowhere is that more true than in the field of healthcare, where the volumes of paperwork are so huge that some medical professionals report spending more time filling out forms than treating patients.
On a day-to-day basis, practicing, I have a ton of paperwork. I have charts that have office notes from patients I see. I have follow-up lab reports, test reports. So a lot of time is spent not only seeing patients, but doing the paperwork that goes along with that. So probably for every hour I see patients, I'm spending at least 30 minutes worth of paperwork.
According to a recent article in the LA Times, doctors and hospital executives say collecting payments from insurers has become an expensive headache that is driving up the nation's healthcare costs. And doctors say one of the most tedious and time-consuming tasks for any medical office is dealing with the paperwork from insurance claims.
The complications of trying to do your own billing are greater than anything we do in medicine. It seems like with over 30 different insurance companies that we probably bill from, not even including our uninsured patients, there's absolutely no way. You don't have a chance.
And then when you submit a claim, it has to be a clean claim for them to even consider it. And you have to do it within 90 days. Doing my own billing was horribly tedious and very time-consuming.
To combat the problem, many medical practices and healthcare facilities are seeking help by outsourcing medical billing.
When medical providers outsource their billing, it makes them and their staff, of course, more efficient. It frees up their time so they can spend more quality time with their patients. And of course, it increases their cash flow, which is what it's all about. And for the patients, of course, the patients are getting to spend more quality time with the doctor and the staff because the doctor and the staff are not having to spend all that time filing the insurance claims and doing the paperwork up front.
Recent mandates by Medicare are already forcing doctors to move to some form of electronic claims processing. But many practices say that dealing with the bureaucracy and constant changes in codes and procedures makes this a daunting task. Outsourcing seems to provide one solution.
We have, as physicians, so many things to worry about. We have to be good business people. We have to be good patient advocates. We have so much on our plate. I go home and I do not worry about this, the most important aspect of our lives. We can't be good physicians unless we're financially solvent. At this day and age, with the complexities of the insurance companies, I can't imagine doing it any other way at this point.
The process for the Medicare billing is, with the electronic claims, is very difficult unless you outsource. Because to do that in your office takes a lot of time, takes a lot of money to buy the software to do the electronic claims. So you pretty much have to outsource to save yourself money, basically.
From a billing standpoint, I have outsourced my billing. This allows me to not have to provide the overhead of an individual that I would have to pay to do my coding, do my billing, make sure that we're compliant with all of the regulations from Medicare and the other health insurance companies.
It's important to outsource your medical billing to a legitimate and reputable firm, one that has the training and ongoing support from a company such as American Business Systems. ABS is the nation's largest network of independent medical billing companies and has the experience and support needed to get more money faster for medical providers.
We've all been in this business for a while. We've all had our ups and downs with different billers. Finding a different biller, as we say, is like finding a good physician.
When you outsource your billing, you have to choose a company where you can track what's happening with each and every account. The billing company I use has the ability for me to check this online 24/7 at my convenience.
The person that we outsource our billing to has a wonderful online system, so we can check on claims, we can update patient information, we can input information into that, so that has made it very good.
Today's doctors want to get back to the business of treating patients and out from the burden of the paperwork associated with billing, insurance claims, and the filing of those claims. By outsourcing to a certified American Business Systems licensee, you can get paid quicker while being able to spend more quality time with your patients. In addition, collections is no longer an issue.
None of us physicians ever feel comfortable with the follow-up if anybody's not paying or unable to pay, but it's still part of fact of life, and that's what they do. They can go after it. They can make any kind of suggestions as far as payments over months, X, Y, and Z. And it just takes me away from that and lets me again concentrate on either doing the business of medicine or further educations or just having free time.
When I outsourced my billing, I was able to give my headaches to them. And they can deal with each and every claim, and is it properly filled, and is it filled within a timely manner, and deal with the insurance company when they deny, why did they deny, what is it that we need to correct. It doesn't have to be my personal headache.
Join the thousands of providers who have realized the potential of outsourcing their billing to an ABS licensee. Enjoy increased cash flow and finally, peace of mind.
Our focus is to do medicine, not billing.
A good physician has to be a good businessman. A good businessman has to decide, when to delegate responsibilities.
Outsourcing has allowed me to get better reimbursement on my claims because I have a whole billing company behind me to check things and take care of that.
Outsourcing has allowed me to spend more time taking care of patients while not worrying about the headaches that are involved with billing and the regulations that go with it.
We're glad you could join us today. I'm Hugh Downs. See you next time.
For more information or a free practice analysis on how to improve your cash flow, contact the person who gave you this DVD or go to cashcrunch2cashflow.com.